welcome to my channel. This is Doing, Being, Becoming, where we aim to inform, impact, influence, and inspire. On this channel, we aim to improve your awareness of occupational therapy, but not only that, we also aim to bring you to awareness of yourself and your mental health. So today, I am with this beautiful lady over here, this Nubian queen, the girl of the girls, the girl who is the girl that she thinks she is. I am with Onitha Longwe. Should I tell them who you are? Do you want?
Maybe let me introduce myself.
Okay.
Yeah. So, hello everyone. My name is Onitha Longwe. I am a physiotherapist by profession. I got invited by this beautiful lady to come and have a talk with you, which is a pleasure for me. I really appreciate inviting me. Thank you so much, and happy Women's Month to everyone. It's August.
So, Onitha, the reason why you're here today, and also for those who are watching, as Onitha said, she is a physiotherapist, and actually the only physiotherapist that I've gotten to work with. So I feel like, she's a great reference and person to speak to when making this video, when you're contrasting occupational therapy versus physiotherapy. Also, just a disclaimer, if your physiotherapist is not Onitha Longwe, you are being done a disservice. Anyway. So, Onitha, just to get us into the video, what is occupational therapy? For those who haven't heard about it. Physiotherapy. What is physiotherapy?
Oh, well, thank you for such a warm introduction. Okay, guys, every physiotherapy that is qualified out there, they are doing a great service, by the way. But thank you for this girl trusting on me. So I would say a physiotherapy is like a 4-year degree, obviously in South African context, that you actually get to do in most universities in South Africa, that actually focuses onto rehabilitating people. So it's more about actually restoring people's function and movement post, it could be illness, pain or injury they suffered, or disability. So we mostly focuses on to making sure that actually we restore your movement, your normal movement, or the normal way that you used to do things. So it's more of like a rehabilitation process. So when we talk about rehabilitation process, it obviously takes long. There's no quick fix, but I would say, like, in just a few words, it's that. Yeah.
Okay. And you mentioned that it's part of the rehabilitation profession, but I'm assuming that within physio there's quite a range of things that you can do and different kinds of physio that a person can be exposed to. So could you please just, delve a little bit into that?
Okay, so I personally love neurological physio. Everyone that I've worked with knows that I actually love that part of physiotherapy, but then there's actually like a broad, when we talk about a broad of things that you can do actually when we talk about physio. So you can do respiratory physio, whereby we focus mostly onto like chest problems, breathing problems. People who have like, chronic obstructive pulmonary diseases, people are like such as asthma, struggling with obviously breathing problems. So when we're looking at like respiratory physiotherapists, like we all know that we are suffering in this COVID-19 pandemic currently, as you know, the world. So a physiotherapist plays a role as well in that, making sure that you actually have proper breathing patterns, that you actually don't struggle from like a respiratory distress. So we kind of like focus as well onto that when we're looking at respiratory physio. And then moving to the neurological physiotherapist, which is my passion. So we're looking at like stroke clients, we're looking at spinal cord injuries, we're looking at Parkinson's conditions. We're looking at like all these movement, maybe disorders, because obviously once you suffer from a stroke, you do have like a movement disorder, a problem that you suffer from, like hemiparalysis, which actually changes your pattern of walking, the way of doing things as well. So we look into those things. And then we have neuromuscular physiotherapist, it's gonna look like I have so many favorites. But then that is also like my favorite. So we focus mostly onto sport injuries, like if you sustain like a ligament injury, sustained a muscle injury, you sustained obviously a fracture as well. So we mostly focuses onto like sport related injuries. But if you're also suffering from like lower back pain or any pain related to injuries, that's where we classify that as neuromuscular physiotherapy. And then we have cardio physiotherapists that we mostly focus on to heart problems. So that's basically like, the branches, but there's a lot we can go on and on, because we see people of different ages as well. Like when we look at young kids, we see cerebral palsy, which is a neurological physiotherapy. And then we see as well like children suffering from like all the like in all these mentioned injuries as well. So like we see people of all age groups.
And yeah, just going back to the chest physio, shout out to all the physios out there who have been great essential workers during this time. Many have recovered because of your efforts, and we really, really appreciate you. So, as a physio, where can you be found? Where do physios work?
Okay, you mean as in like the place? Like, okay, we are found in hospitals. There's hospital-based physiotherapists, and then there's house call physiotherapists that you actually you can go and look at your internet. Physiotherapists available in your specific area. There are people like we're having like online like information about where are they based, whereby they can do like house calls or house visits. You just phone them that okay, I might be having COVID. I have a struggle to breathe and whatever. I'd like you to come and see me in my own space, and then we do the home visit physiotherapist, and then you can find them in clinics, especially in like urban areas. Obviously, they are clinic-based physiotherapists. So we're mostly everywhere. We're pretty much everywhere. You can find them in gym. There are people with their private practices as well that have their own gym spaces. So we everywhere.
So still on that COVID topic, so obviously this is a pandemic that has changed everybody's life, so obviously, and our daily lives has changed since the whole pandemic has started. So for you personally, how has COVID-19 changed how you go about your work?
Okay, when it comes to work, I wouldn't lie, because obviously we know how this pandemic and lockdown has affected people movement and obviously people's mental state. There's so much fear out there, including the clients that we get to see every day. The fear of actually visiting the hospital facilities because they don't know who has COVID and who doesn't have, because other people can be asymptomatic. And obviously you would think as a normal human being that hospital is a hotspot for COVID. So due to that, we haven't been receiving so many clients to come for physiotherapies because they actually have the fear. So it did actually impacted my life now in terms of like what I do with my time every day. However, I haven't received any COVID referral from the doctors in the hospital, but then I still educate myself at that time actually in terms of like if I were to receive a COVID client as a physiotherapist, how I will manage that client in terms of their respiratory condition. So I think it has actually changed obviously my pattern, but not so much into a bad way, that now I'm more as well about reading literature and actually improving my own self. However, like, with my life personally, obviously I do have a level now of feeling like there's some level of disengagement with like, with the society, because due to the lockdown regulations, you have to stay at home. I've tend to have like disinterest as well into things that I used to enjoy before, that they're no longer fun anymore, because it's more like of a repetition, doing the same thing, which is not nice at all. But then I guess we're living every day. We're trying hard to survive at least the pandemic.
Wow. So you touched on about how patients are coming less into the hospital because of COVID, and they're scared they might contract it because hospitals are hotspots for the virus. But generally, it's difficult for your patients to come to the hospital anyway because you work in a rural area, and most people live far from where the hospital actually is. So as a physio working in a rural setting, how is that experience for you?
Okay, well, that's a beautiful question, I would say. So, for me, I've always wanted to come to give back to the community that I was raised in, because obviously I come from rural, like villages of Utendane as well. So it has always been my
Shout out
dream.
to my Mugandane. Hey.
So it has always been my dream to actually come back and give back to the community that actually has raised me and that has installed the values and principles in my life. Obviously, I always knew that there's lack of services in these areas, and I actually always knew that actually they need me to be the change, because obviously if you can't complain all the time, you need to become part of the change. So I really wanted to dedicate myself and my life into becoming the change. So however the experience, it is not so much of something that I didn't expect, because I know the financial barriers of the people that we actually see every day, because I've actually been part of the community as well before I actually worked as a physiotherapist. So I always knew that most people are dependent on social grants, and they're coming from far villages to actually come and access our services, which is physiotherapy services that are actually good services. Like, let's say I have a CVA client, I would honestly in real life setting like to see that client every week, but due to financial barriers, now we have to find ways that are actually working for both me as a physiotherapist and my client, because obviously I have to be more now client-centered. And being a client-centered healthcare profession, it means understanding your client holistically, that who's this person that I'm treating, because obviously in university, they would give you all those working techniques that, oh no, you have to book them every week. And obviously I'm graduating in Cape Town and working in Cape Town most of the time. I never got exposed to the challenges that I'm seeing here, where I actually working now as post-university. So it was always nice to actually bring your client back, because they have access to transportation. They don't have to spend so much money like people here. People here, if you're disabled and you have to use a transport, number one, you have to hire a special transport, which you pay half of your disability grant money. So it's
for one appointment.
Exactly. And it's those challenges that are actually very painful, but then we have to find ways of how do we actually work together as a client. It's either you equip and train the family, so that in the meantime, when we're waiting for your next appointment in a month's time, do this thing every day at home. So, and I've actually also discovered the telephonic appointments as well, just checking them.
Telepathy.
Yeah.
Not telepathy?
Telegram.
Telehealth.
Exactly. So it has been working nicely as well, that you actually phone your clients, find out how are they doing, finding out if are they improving and all of that. So which is now we have to find other new strategies to actually compensate for what you think should be great and best for your client. So so far that has been my experience. It has been a beautiful experience. However, with its challenges, I honestly love seeing the clients here. Yeah.
And obviously, in the time of you enjoying being a physiotherapist in rural health, you've worked with quite a few occupational therapists. How has that experience been for you?
Okay, well, yeah, that's a beautiful question again. I guess today we're having great questions. Oh, wow. Okay, it was good to actually learn about other occupations beside me as a physiotherapy, especially other rehabilitation, occupations. It was quite eye-opening for me, because I worked closely with them to the point where they were sharing the offers. So it's quite easy to actually plan about the certain client in terms of okay, what are our goals as a rehab team. And it was amazing actually to learn from this wonderful profession actually what they can do for an individual. And it actually linked very much with what physiotherapy is about and what we're doing. Because most of the time, obviously you have a client coming in, oh, I have a shoulder injury, it's so painful. Obviously, me being your physio, I want to treat your pain, I want to make it less painful, I want you, to get the range. But then I never draw much onto what are we getting this range for. And then that's where the OT
what's
comes
causing the pain?
Exactly. So that's where I think the OT comes into handy, that actually you want to be able to hang your clothes, your things such as underwears that you actually want to be hang them yourself as a person, as an individual. So it was more oh, this is why we're doing this, but you sometimes miss like, the fuss from clients, like why do they want to do certain movement? And OT really comes very beautiful into that, as in like, okay, what are your activities? I've learned about that, activities of daily living. And what do they include? I need to be able to wash, to bath. This pain is limiting me from doing that. Whereas for me, I'm like, okay, let's get rid of that
Get your pain free.
But then you're like, oh, let's get you doing that activity, which is beautiful. It has been like a beautiful journey to actually, as a physiotherapist, to work with OTs and to see now how these two professions comes together. Although we have so many things that we differ from, but then we have so many things that we're actually similar about.
Which actually links into my next question, because before we get to about how our perceptions have changed, because my perceptions about physio have also changed since working very closely with you, but the reason why, or people get OT and physio very confused with each other, because they're both in rehab and we do work so closely with each other. But what are the differences? Like, what's the difference between OT and physio?
Oh, wow. That's an interesting question. I honestly can't really put my finger onto it. But then I would probably say in this question, it's probably most of the times treatment modalities. What do we use to treat the client? We might actually be treating like, the same condition, but then how do we use and what is our focus into actually treating this condition? Just to give an example, like for physio, we use mostly like, electrotherapy as well as part of treatment. That includes ultrasound, that includes hot packs, that include TENS machine. We use cryotherapy, that includes use of ice. There's so many treatment modalities, and we also use a lot of our hands, as in like manual therapy. And there's obviously more of like client education and family education and advices, which is more of the same things that OT do as well in terms of client education. But then, like when we come to the treatment modalities, like for us physios, it's probably focusing on to the actual tissue, the actual the actual like problem with the injury. Oh, okay, you have this pain in the knee, or you had an MCL. But then, like, the client actually wants to be able to walk to work, wants to be able to sit in their work economic setting. And then I think that's where the OT comes into play. So we shouldn't actually confuse these two professions. Yet they look the same, and maybe the ultimate end goal will be the same, but then we have different approaches into like, the end goal. Because for me, you come with your injury, it's more like, okay, let's treat the injury, let's get the range. Okay, but for OT, it's like, okay, you want to fit in your desk at work due to this. How can we modify your activities, or how can we modify your working environment to make sure that you fit? But for physio, it's more like, okay, let's get this knee going, let's get this knee bending, let's not modify, things that much. I think that's more where you find our differences, and sometimes our differences in thinking process. This other time, actually, I was actually laughing that I have a personal problem with vultures. Like, I'm just like, we need to get you up and going. But then an OT would come that we need to give you this assistive device to help you to access these places that you can't access. But for me, I'm like, no, I hate that. You need to get moving, you need to train yourself. So as much as obviously from an OT perspective, it's not something that I want you to rely on this wheelchair, do not move. But it's a matter of like, in the meantime, we're still waiting for that. Let's modify your life in terms of making access easy for you.
So you can still do what's meaningful to you.
Exactly. But for me, I'm just like, I have a personal issue and we need to get up and going. So I think that's where we mostly differ. I hope I answered the question.
I think you captured it very, very well, actually. That physio is, yes, in the end, we all want you to function, properly and to your best. But physio, the aim is actually towards the injury and treating the injury. And for OTs, it's about independence. And if there's an injury that prevents you from doing that, then we deal with the injury, So yeah, I think you captured it very, very well. So before we end, I think, like I said, I hadn't actually worked closely with physios before I worked with you and the other physios in Victoria Hospital. And yeah, well, my perceptions of physio, my perception of physios, you know, and I think it goes back to what you were saying, move, I want you to move, just do it, just go, is that physios are actually quite strict people. They have type A personalities. Yeah, and you know, there are these rigid people, and you know, obviously my perception has changed since that. But above that, I think what I've really appreciated about working alongside physios is that being able to plan sessions together, being able to treat patients together, and actually as a team being able to see how patients improve over time. So yeah, I really appreciated that whole MDT-ness and interconnectedness, and be able to think, you know, together, because I think a lot of the time as health professionals we work over each other, or we miss what the other one is doing to the detriment of the patient, you know, because we're all doing our own thing, working parallel to each other, but not working together, you know. So that's something that I actually appreciated about, you know, working in the rehab. So yeah, what were your perceptions of OT? How have they changed?
Since working with you, it was always about this, you know, I don't want to put it in a bad way, but okay, they quite very calm people. They're very
opposite of the type A strict people.
Yeah, and actually, like, it was more of like, oh, it's maybe this profession that actually promotes laziness in a way. Like, I was just like, why would you give this person a wheelchair, whatever? So I had the feel like, you know, it was more of about that. But when I understand, because obviously I was obviously lacking with being client orientated as well. What does the client needs? It was more about like being a physiotherapist and orientated on my goals. What do I want to achieve with this person? But I've realized working with OTs that actually it helped me more and more in terms of improving myself and to becoming more client orientated. Because if the client is actually like not obviously improving and not keen to improve at the pace and the rate of a physiotherapist, that's where like an OT comes in handy. Like, okay, let's borrow you this wheelchair or this assistive device that would actually help you to access things that you want to access. In the meanwhile, obviously people have to continue with their lives despite of their injuries and illnesses. So I really felt
because life goes on.
Exactly. So with an OT, I really learned being very client orientated. What does the client want, and how do we actually achieve all those activities of daily living, which is I really appreciate, like, you know, your job, guys, and what you do for the world out there, because we might take other things very like lightly. Because I remember I was once speaking with my colleague, and she said that, oh no, I actually felt it when that lady said I couldn't wash my underwear. And when you think about it, no one wants to wash anyone's underwear. Like, so like being client orientated, it's actually getting her doing that activity. Like it was very like, you know, touching and very like okay, this is a very meaningful, like, you know, profession, and they know what they're doing, and getting to know them better, it actually helps to appreciate them and the job that you actually do, and improving our clients every day. We really appreciate you. We appreciate your input into this world. Yeah, but obviously that perception I had, it went away, obviously, with knowing the profession and getting to understand how you guys function, how you think, and how you reason, because that's what is important. That what was the reason behind this treatment, what, you know, what were your thoughts. So which was quite beautiful.
And I think that just speaks to assumptions, you know, because we all make assumptions, but the way we can actually break those assumptions, actually speak knowledge and truth into the assumptions, is getting to know the person. You know, it happens with people. We all, you know, prejudice and discrimination, and that's all based on ideas that we have outside of actual experiences. So once you actually get to know a person, then, you know, like, you dismantle all those assumptions, you know. So getting to know people is actually quite important. So Onitha, you know, this channel aims to inform, impact, inspire. Yes. And we know that you are also a person who's very dedicated to youth empowerment, you know, inspiring others yourself. So as we just come to the end of this video, what's the one message that you want to leave with our OT today?
Okay, obviously because we are in the middle again of the pandemic, I hope you do what you love and what you enjoy, and I hope you actually get your mental state into right. I know it's not easy, but maybe with a little bit help of an occupational therapist, you can actually get that on board. But I hope you all are happy out there and actually doing what you love, and yeah.
Well, anyway, thank you for watching this video to the end. Please let us know in the comment section what you enjoyed about this video the most. Any additional questions you may have for Onitha. Also, if you wanted to come back, let us know in the comment section. Yes. Thank you so much for engaging with us. Until the next video, do your best to do, be, and become.